Welcome to the video lecture of the respiratory system for the subject Human Anatomy and Physiology, Pharm.D first year. Now this video is presented by Dr. Akash Mathuria. Right, so in this particular lecture we are going to study the anatomy and the functions of the structures which are involved in the respiratory system. Now respiratory system, as you can see, this is the anterior picture of the respiratory system, and it is usually divided into two types. First type is structural division and second type is functional division. Now structural division, as you can imagine, the portions which are located on the upper part of the respiratory system will be consisting of upper respiratory system, and the portions which are a part of lower respiratory system are named accordingly and are called as lower respiratory system. So the part which belongs to upper respiratory system are the nose, the nasal cavity, the pharynx. The part of the lower respiratory system are larynx, the trachea, bronchi, and the lungs. Now functionally, as I was saying, the respiratory system can be divided into conducting zone and the second zone, that is nothing but respiratory zone. Now let's talk about conducting zone first. Right, so conducting zone, as the name suggests, it is going to help air enter into the lungs. Right, so anything which helps air to enter inside the lung will be called as conducting zone. Now what can be the part of conducting zone? So the structures which are outside the lungs can be the part of conducting zone. So these structures usually are tubes and cavities. So these structure, if you can imagine, can be nose, can be nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, and terminal bronchioles. So imagine any structure which is outside the lung, any cavity or any tube which is outside the lung will be part of conducting zone. The second zone, that is the respiratory zone, it is the tubes or the tissues which are present inside the lungs. So as you can imagine, the major function of this zone is to provide exchange of the gases. While the function of the first zone, the conducting zone, is to moisten the air, is to warm the air, and is also to filter the air. Now let's talk about the upper respiratory system and the very first part of the upper respiratory system, that is the nose. Now as you can say and as you can feel, the nose is the external part of the respiratory system, or you can say it is the only visible part of the respiratory system. Now external portion is actually made by a bone which makes the framework of the nose. Now if you can see, the extension of the bone, the bony framework, is towards the anterior portion. The muscle will be covered on this particular zone, which is the nasal bone, and it is going to form something like a bridge. Now there are many cartilages which you can see in the form of white color in this particular diagram, which are going to be lying on the nasal bone. Now based on the position of these cartilages, they are named accordingly. So basically there are three types of cartilage. First, which are present on the lateral side, which is called as lateral cartilage. The one which will divide these cartilage and which is present exactly in the center, which is septal cartilage. Then you have alar cartilage. Now alar cartilages can be called as major alar cartilage or minor alar cartilage. Now the major ones, which are forming the major portion of the cartilage, and the minor ones are the ones which are following the small, or which are making the small cartilages in this particular alar cartilage. Now external portion of the nose also has something called as nares. Now, nares are nothing but the cavity, which is exactly the opening, you can say. The opening of the nose is called as external nares. It is also known as nostrils. Now, the size of this cavity is about a fingertip. Now, there, if you can see, it is made up of, so it is having so much of hair, right? So you can say the skin of this particular area, or the skin of the nostril, or the skin of the nair, is made up of numerous hair. It has sebaceous gland, it has sweat glands that secretes on the surface, right? So we can say the external nares is usually a size of a fingertip, and it can be made up of sweat gland, sebaceous gland, and has numerous hair like projection in that. Now followed by that is the nasal cavity, and the nasal cavity is followed by something called as internal nares. Now the ones which are present inside, or the opening which is present inside the nasal cavity, so you can say this cavity is present posteriorly. The external nair was present anteriorly, while the internal nair will be present posteriorly. Now it also has an arrangement of nasolacrimal duct. So here all the tears and all the secretions of the nasal cavity will be coming down in this particular place. Now the nasal cavity has two types of region. The one which is present inferiorly is also called as respiratory region, and the one which is present superiorly is also called as olfactory region. Now the olfactory region will have so many olfactory receptors. So olfactory, as you can imagine, is usually dealing with something called as sense of smell. Now the receptors are going to help you smell different things, and it is connected to olfactory epithelium. Now this lining, the membrane lining of the olfactory epithelium is exactly adjacent to the nasal septum. Now there is something called as respiratory epithelium, which is exactly present on the inferior portion. So in short, there are three major functions of our internal nose. First is to warm the air, to moisten the air, and to filter the incoming air. Second is to detect the smell, and third is to modify the speech vibrations. Move on to the next structure, that is the pharynx. So the pharynx is also known as throat. Now in this diagram, if you can see the colored structure on the left, the yellow, the blue, and the pink, if you can see together, they are going to make a funnel shaped tube. That's why this is one more characteristic of pharynx, that it is a funnel shaped tube like structure. The size or the length of the pharynx is about 13 centimeter. Now the internal nares, where they are going to end, it marks the beginning of the pharynx, and it is going to extend up to the larynx, and specifically at the level of the cricoid cartilage. The location of the pharynx, if I talk about precisely, as we talked, it is posterior to the nasal or the oral cavity, it is superior to the larynx, and it is anterior to the cervical vertebrae. Now if I talk about the composition of pharynx, so pharynx is composed of skeletal muscles, and it is lined by mucous membrane. Now why skeletal muscles? Because whenever the skeletal muscles are going to contract, they are beautifully going to assist in the process of deglutition. This process is also called as the process of swallowing. So in short, Pharynx is helping us in the process of swallowing. So apart from this, if I want to generalize the function of pharynx, that because of the openings of the nares, it is providing the entry to the air, and because it has skeletal muscles which can contract, it has opening for the food as well, and it is going to, and because it is extending up to something called as larynx, right? If you remember, I repeated that it is going to extend up to larynx, right? So because larynx is also known as the voice box, it is somehow participating by providing it as a resonating chamber for making certain speech sounds. Another characteristic of pharynx is that it has so many tonsils. That means it houses some tonsils. Now pharynx, if you can see in the left diagram, that it has three colored, that means it is divided into three portions: nasopharynx, oropharynx, and laryngopharynx. So the superior most portion, which you can see in the form of yellow color in the left, is nasopharynx. Now nasopharynx is going to extend from the internal layer towards soft palate. Now soft palate marks the ending of the nasopharynx, and it, if you can see, is the arch shaped muscular partition between nasopharynx and the oropharynx. The peculiarity of nasopharynx is it has 5 openings, right? So 2 openings of the internal nares, if you remember the respiratory zone and the olfactory zone, right? So 2 opening of the internal nair, 2 opening of auditory tubes. The auditory tubes are going to help us maintain the balance, and it has one more opening to the oropharynx. Because of the soft palate, it has one more opening to the oropharynx. Now because it has some connections to the internal nair. Now internal nair, if you remember, has some cilia, and it is going to push the mucus downward. So downward part to the, or the posterior part to the internal nair is nasopharynx. So that is the reason nasopharynx is also lined with pseudo stratified ciliated columnar epithelium. Don't try to remember this, but it has ciliated columnar epithelium, right? So what the cilia is going to do, so this mucus which is pushed down from the internal nair from the nostril is going to be pushed down to the nasopharynx, and because it has ciliated columnar epithelium, the cilia can be moved downward to the inferior portions. Now there is housing of pharyngeal tonsil in nasopharynx. Right. Next is the oropharynx. Now the oropharynx is the intermediate portion, as I discussed earlier, and it is the posterior portion. If you can say the location, the location is, it is located to the posterior part of the nasopharynx, and it is extending from the soft palate. If you can remember the position of the soft palate in the diagram, the bluish portion is marked as oropharynx, if you can see. Now oropharynx is going to serve as a entry to the food as well as entry to the air, right? So this portion is very sensitive because it will be having so much of aberrations because of the food. So you cannot make it pseudo stratified ciliated columnar epithelium cell, right? So that's why, because it has to deal with so much of aberration of the air, food and drink, this is made up of non-keratinized stratified squamous epithelium. Now this particular pharynx consists of palentile tonsil and something called as lingual tonsil. Now next, the inferior most portion of the pharynx is called as laryngopharynx. The another name of laryngopharynx is hypopharynx. The inferior end of the pharynx opens into esophagus, right? So you can say the laryngopharynx has two types of opening. One is in the esophagus and another is into the larynx. So how can you define the openings? So the one which is present posteriorly is the esophagus, and the opening which is present anteriorly is the larynx. That's why this is also called as laryngopharynx. Now, because it has to deal with both digestive pathway as well as respiratory pathway, again it is made up of stratified squamous epithelium. Now, because it has muscles which is innervated by some nerves. So usually two types of nerves are going to be innervated in this area: glossopharyngeal nerve and vagus nerve. Right, so moving on, now we are going to talk about the part which comprises of the lower respiratory system, which is nothing but larynx. So larynx is also known as the voice box, and it is serving as a passageway or a connection between the laryngopharynx and the trachea. If you can see in the image, the one on the left is the anterior view of the larynx and the one on the right is the posterior view of the larynx. Now larynx is actually lying exactly in the midline of the neck. It is positioned anterior to the cervical vertebrae. Now if I want to be specific, it is between C4 to C6 vertebrae of cervical vertebrae, right? Now the walls, if you can see, of this larynx has so many cartilages. The ones which has whitish appearance in the diagram are nothing but cartilages. So there are actually 9 pieces of cartilages which are forming larynx. So usually it is divided in two types, the one which is unpaired and one which is paired. So usually 3 pair cartilages are present and it is comprising of 3 unpaired cartilages. So let us talk about the 3 unpaired cartilages. So first out of them is the thyroid cartilage, next is the cricoid cartilage, and third is the epiglottis. These 3 are nothing but unpaired cartilages or unpaired pieces of cartilages. Next is the paired pieces of cartilage. One of that is arytenoid cartilage, which you can see on the posterior view of the larynx. The cuneiform cartilage, which you can see on the lateral view, which has appeared on the rightmost portion of your screen. And the third type is, or the third pair cartilage is corniculate cartilage, which is again visible on the posterior side or the posterior view of your larynx, of the diagram of your larynx. Right, now let's talk about the thyroid cartilage. The thyroid cartilage, as you can see, is the biggest cartilage or the largest cartilage. And if you pay attention, it has 2 fused plate, and this fusion leads to a V-shaped formation. Now this V-shaped formation also has a junction in the between, right? So this junction is also known as laryngeal prominence or Adam's apple. Now because of the influence of hormones, it is bigger in male while it has slightly small growth in female. Now usually the growth of this Adam's apple starts in the puberty. Now next, after this we are going to talk about the next cartilage, the unpaired cartilage, that is epiglottis. Now epiglottis, because it is present over the tongue, glottis means tongue and epi means over, it is called as epiglottis. Now it is a leaf shaped organ and it has elastic cartilage which is covered with epithelium. Now, because it is broad leaf like structure, it is free to move up and down. Now, if you can imagine a leaf and which has all the freedom to move up and down, it will actually act as a trap door in our setup, which is nothing but larynx. So trapdoor is very helpful when you are swallowing something. What happens when you swallow is the pharynx and larynx are going to rise up, and this elevation of pharynx is going to widen and help us to receive food and drink. Imagine if the pharynx and larynx are not rising up, the swallowing process has not being it is not enabled because of the not rising of pharynx and larynx. Then what will happen? This will not widen, and that is the reason if pharynx and larynx fail to rise, this particular cartilage will not receive food and drink, right? Now when I'm talking about food, receiving of food and drink, what happens in this is the elevation of larynx usually is going to cause the opening or moving of the epiglottis, or you can imagine it to be the opening of the lid, to be frank. And when it is falling, then the lid is going to close, right? So this is how the epiglottis is going to function with conjunction of the other pharynx and larynx up and down motions. So epiglottis is, you can say, a trap door of our larynx which controls what to enter and what not to enter. The next is the cricoid cartilage, which is a ring like structure, if you can see on anterior and the posterior view, and it has cricotracheal ligament on the above surface of that. Now we are going to talk about the structures which are going to help us in voice production. Now before moving on to the structures of voice production, I just want you to brief about the paired cartilages which we talked about, 9 pieces of cartilage. So it has not much significance, these paired cartilage, but the arytenoid cartilage is also providing mobility. The corniculate cartilage is also somehow going to provide mobility, and cuneiform is also going to provide mobility. So in short, these paired cartilages that I had mentioned earlier are going to provide some sort of mobility to either the vocal cords or to either the epiglottis, which can facilitate the inward motion or receiving of food or drink or air, or maybe the movement of the vocal cords, which is going to help us modulate the pitch. Now let us see in detail what are the structures of voice production. And usually for the voice production purpose, the vocal folds are going to help us make some noise, isn't it? Okay, so the diagram on the right is actually taken from the laryngoscope, and both these diagrams are actually the superior view of the larynx. Now the vocal fold is the major structure which is going to make some noise, right, which is helping us in producing some kind of voice. Now the vocal cord has so many, or you can call it to be vocal fold, has so many laryngeal muscles attached to it. Now these muscles, if you remember, are attached to the cartilages which we discussed in the earlier portion, right? When these muscles are going to contract, what happens is it is going to tighten these cartilages. So the contraction and relaxation of these muscles are actually going to cause different types of tension on the vocal fold indirectly. because they are connected to the cartilage and cartilage are connected to the vocal folds, the movement of the muscles are going to tighten or maybe relax the vocal fold, or you can call it to be the tension is relaxed or it is becoming more tensed. Just imagine it to be a guitar string. As you move up the key, as you loosen the key, the guitar string is loosened, and as you tighten the key, the guitar string is tightened, right? Now the air passing into the larynx is going to vibrate here. The air is actually very essential when you want to make a noise. Without air, if you can try for yourself, try not to breathe and speak. You are not able to speak after some seconds because you run out of breath. So, what proves is that air is very important. If the air is not going to pass, you are not going to make any sound. And the process of producing sound in the presence of air is called as phonation. Now, sometimes phonation can be without air also, but it is not for prolonged period. That's why I mentioned this thing in the presence of air. So, the process of producing sound, in short, can be called as phonation. So, as I discussed, when the laryngeal muscles are going to tighten, the vocal folds are going to have different shapes, and this will make us make us help which this will help us to make different types of pitches, right? It can be high pitched sound, it can be low pitched sound, right? So let us see with the help of the diagram. Now if you see the posterior cricoarytenoid muscle, when this is going to contract, it is going to move the vocal apart, and this is going to cause abduction, right? In short, when the posterior cricoarytenoid muscle are going to contract, they are going to relax, they are going to move the vocal folds apart, and this will make a process called as abduction. When the contraction of lateral cricoarytenoid muscle takes place, it is going to cause something called as adduction, or you can say closure of the vocal fold, right? So contraction of posterior cricoarytenoid muscle is going to cause abduction, while contraction of the lateral cricoarytenoid muscle are going to cause adduction. As I discussed earlier, the paired cartilages which we discussed in the larynx are helping us in movement. So what is this movement? You can see it. It is helping us in the process of voice production. In the next phase, I would like to talk about trachea, but before moving on to that, I want to discuss something about pitch. Now, what happens is we make so much amount of, or you can say you can modulate your voices in different types. It can be high pitched, it can be lower pitched. If you hear to my voice, it is kind of high pitched voice, right? And if you listen to a female voice, it is more high pitched voice. Now the reason of this muscular is the muscular tension. Now sometimes the hormones also play some important role in the amount of the tension that can be produced on the vocal cord, right? So for example, in males, due to the influence of androgens, if you remember, the vocal cords will be thicker. So thicker vocal cords, that means they will be making more or heavier amount of voice, or you can say the pitch of the voice will be lower, right? Also, because of the androgens, the vocal cords are longer. Because they are thicker and longer, they are going to vibrate slowly, and this slow vibration will lead to the production of low pitched voice. And that is the reason men's voice are lower range as compared to women's. Now whispering, if you know, so what happens in whispering, basically the posterior portion of glottidis, there is some part, it is going to help us vibrate the vocal folds. Actually what happens in normal voice production, there will be vibration of vocal fold. If it is a vibration in male, the vibration will be comparatively slower, and that will be making low pitched voice. But in case of whispering, the whispering has no pitch. If a female whispers or a male whispers, the whispering will be intelligible, isn't it? So this is because the amount of resonance, the amount is actually happening, the production of this whispering is happening only in the oral cavity, and this is the reason there is no vocal cord rubbing, and that produces something called as whispering. So now we are moving on to the next part of the lower respiratory system, that is nothing but trachea. So in this diagram, if you can see, the trachea is in the form of tube. That's why it is also called as a windpipe. Now because the word trachea itself is derived, or you can say means sturdy. So this is one sturdy portion of respiratory system. Now as you can see in the diagram as discussed, it is in the form of tube, hence it is one of a tubular passageway for the air, and it is taking the air which has come from the larynx to the internal or the respiratory zone, which is nothing but lungs. So if we talk about the location, it is located anterior to the esophagus. If you can see in the diagram to the right, which is the superior view, on the left is the anterior view, and yes, so if you see the diagram on the right, the superior view shows that it is present anterior to the esophagus. The size of trachea is about 12 centimeter in length, and it is about 2.5 centimeter in diameter. Actually, at the junction of T5, trachea is going to divide into two parts, and from there on it is known as bronchi. So as I was saying, the trachea is sturdy. So this sturdiness means there are some layers which makes it sturdy. So usually if I talk from deep to superficial, नीचे से ऊपर तक, so the first in the deepest part is the mucosal layer, then you have the submucosal layer, then you have the middle layer, or it is also known as the middle tunic layer, and the fourth layer, the most superficial layer, is the adventitia layer. Now the mucosa actually consists of epithelial layer, which is epithelial layer of pseudostratified ciliated columnar epithelium. Now what they are going to do is basically they are going to provide protection against dust, and they are also providing lining for the membrane lining that was present in the nasal cavity and the larynx. Now beneath the columnar epithelium that I just discussed, there is one more layer inside the mucosa. That means mucosa is divided in two layers, you can say. The underlying layer is called as lamina propria. Now this is actually elastic, and it is going to consist of reticular fiber. Next we talk about the superficial layer to mucosa, that means the second most layer, deep layer, that is the submucosa. The submucosal layer is going to consist of areolar connective tissue. Now what they are going to contain is they are going to consist of seromucous gland and the ducts of these glands. Now what they are going to do is they are going to secrete some mucus and it is going to maintain the consistency of this particular region. Now the next region, the third region or the third layer is the middle tunic as discussed. Now this layer actually is made up of hyaline cartilage, and because it resembles to the letter C, this is also C-shaped layer you can say, and this provides the ring-like projection to the trachea. Uh, I would also like to add that within this there are some smooth muscle fibers which are called as trachealis muscles. Now muscles, if the general property of muscle is not only to provide strength, it is also going to provide some flexibility, right? So same thing, this trachealis muscle is actually going to provide not only the strength, but it is also going to move or adjust the diameter of trachea when you are under the process of inhalation and exhalation, right? So this is actually, you can say, not a rigid but a semi-rigid support to maintain the consistency of the trachea throughout, so that it does not collapse inward or something like that. And the most superficial layer that we talked about, the fourth layer, is adventitia. Now this adventitia layer is actually consisting of some tissues, the connective tissue, which are joining the trachea to the surrounding tissues. So they are only there for connecting the trachea to the surrounding tissues, right? So if I want to summarize, the trachea is one of the sturdiest part of respiratory system. It belongs to lower respiratory system. It is located anterior to esophagus and it has four layers. The deepest one is mucosa, the second deepest is submucosa, the third is the middle tunic, and the fourth is adventitia. The mucosa is going to protect against the dust. The submucosa is again consisting of some seromucous gland. The middle one is going to provide the strength as well as the flexibility and resembles the letter C because of the presence of hyaline cartilage which are C-shaped. It also consists of muscle which is called as trachealis muscle as discussed, and the fourth and the most superficial part is called as adventitia and it is connecting trachea to the surrounding tissue. So moving on, now we are going to talk about the bronchi. So in this diagram on the screen, if you can see, the left diagram on the screen is the anterior view of the trachea and the bronchi, and on the right is the posterior view. Now what happens is the trachea is going to divide at some point. Now exactly it is going to divide at the fifth thoracic vertebrae. Now it is going to divide into two. The one is the one which is going on to the left and the one which is going on to the right. Now because this is the first division before entering into the lung, it is also regarded as primary bronchus. Now I'll tell you one thing about bronchi, that bronchi can also be called as windpipe. So whole structure is a sort of windpipe. Okay, so the extension of the right primary bronchus will be entering the right lung and the extension of left primary bronchus will be entering the left lung. Now it is understood nicely. The right primary bronchus is more vertical. If you pay attention to that, it is more vertical then the left, it is more wider than the left, and it is kind of shorter than the left. Now, because of these qualities, what happens is the aspirated objects, whatever you are aspirating, are going to enter here and then lodge here. That means they are going to stick or get stuck in this particular bronchus. So, the right bronchus is where the aspirated things are going to get choked up. Now, if you see exactly from the point where right and left are bifurcating, right, this is called as carina. Now, carina is derived from the word keel of a boat. Now, what happens is, because it is the point from where the bronchus are dividing, there is incomplete cartilage, just like the projections that we have seen in the trachea. Now, this is the most sensitive area, and it is the, I think, last tracheal cartilage projections which are present. Now, after carina, what happens is the primary bronchus are going to enter the lungs, and they are going to get divided into secondary bronchi. If you pay attention on the anterior view, the same thing will be applying to the posterior view. The secondary bronchi, what happens is it is dividing inside the lung. Now, from the secondary bronchi, it is again going to divide into further more complex thing, that is tertiary bronchi, and then from there they are going on to divide into bronchioles, and after bronchioles they are going to terminate, and that's why they are also known as terminal bronchioles. So if I had to say, the branching of the bronchial tree starts from the trachea, it follows to the primary bronchi, then it divides into secondary bronchi, then it extends up to tertiary bronchi, the bronchioles, and the last part is the terminal bronchi. So this is a complete structure of the bronchial tree that you are seeing on the screen. Now, there are certain structural changes as the division proceeds of the bronchial tree. The basic changes I would like to tell, the first amongst that changes is the mucous membrane in the bronchial tree will change from pseudostratified ciliated columnar epithelium, which will be more towards the upper portion, or you can say the superior portion, and as you are going to move towards the tertiary, the ciliated columnar epithelium will become simple cuboidal epithelium. They will be ciliated, but they will be becoming cuboidal epithelium. Now, second change what you are going to say is, see, is the plates of the cartilage are replaced by incomplete rings. So that means in the primary bronchi you will see some incomplete rings, and finally in the bronchioles they are going to disappear. So as I told, in the carina you will see some portions of the incomplete ring, and on the diagram itself you are able to find that as you are moving towards the end, the ring structures are kind of disappearing. And the third structural change you will see is the amount of cartilage decreases and the amount of smooth muscle increases. So what happens is, the smooth muscle is actually going to spiral the lumen. Now what happens, why we need smooth muscle here is because we want to maintain the patency. The patency is nothing but inhalation and exhalation. So there is no supporting cartilage, in short, as you are proceeding toward the end. So in such condition, there are muscle spasms. So when the muscle spasm will occur, the cartilage are not there to prevent complete closure, and this is the reason for the airway closure when there are life-threatening situations like asthma attack. Now, because of complete absence of cartilages, supporting cartilages in the end bronchi, which are nothing but bronchiole of the bronchial tree, uh, the smooth muscle spasm can lead to life-threatening situation, right? So, in short, this is the complete structure of bronchi, the function of bronchi, and the bronchial tree branching. So stay tuned for the next series where we are going to discuss the lungs and the physiology of respiratory system. Thank you.